My fellow Americans, tonight I want to speak with you about our nation's unprecedented response to the coronavirus outbreak.
Good evening and thanks for joining us. The World Health Organization has now confirmed what many epidemiologists have been saying for weeks. The coronavirus is...
All right, people, let's look at the actual numbers. There are 134,036 cases total reported in the world in over 110 countries. There's 4,964 deaths and 68,898 people have completely recovered from this disease. There's 60,174 active cases that have reported nothing but mild symptoms. That's 90% of people infected with mild symptoms. The other 10%, which is 5,947, have come in with acute symptoms that are considered severe or critical. Now, 0.4% of those people between the ages of 40 and 50 have found this to be critical enough to cause death. And for those patients that have come in under the age of 40, the death rate is only 0.2%. And for those patients that are between the ages of 0 and 9, there are none. No patients between the ages of 0 and 9. Let's look at the overall mortality rate. The World Health Organization has said it's 3.4%. However, this number does not include the thousands of cases that have gone unreported. For passengers that have gotten off of planes, cruise ships, or just walked around their city, gotten infected with the virus, went home, thought they had a cold, waited it out, and are completely fine now. Now let's talk about the presidential address last night. The World Health Organization has declared it as a pandemic, a word that the CDC and the WHO has not used in over 20 years. There's really no definition for it either. It's just kind of a murky, scary word that is kind of used to describe medical conditions that have spread to multiple countries and are no longer contained. Number 2, the president kept talking about working with the allies. Well, guess what? There are more than our allies that are suffering from this disease, including Iran and Syria. We need to work with the global community to be able to make this outcome better than what it's currently turning into be. Number 3, don't blame the EU for the United States' virus count. It is absolutely ridiculous to say that because we stopped Chinese flights from coming into the United States, but the EU didn't, that's the reason why we have such a large spread now in places like Washington, New York, and Los Angeles. If you're talking about working with our allies, don't piss off the EU. Which brings me to the next point, the travel ban. All Schengen countries are now banned from entering the United States. Now let's take a look at what this actually means. All flights operating from the EU to the United States are still going to operate. The only difference is the passengers are only going to be Americans or American nationals that have resident cards, or those passengers that have gotten waivers from their own country because of business needs to come here. Except for the UK, of course. Thanks, Brexit. Emergency powers that the United States government plans on using. Waiving insurance co-pays and premiums. I believe we call that socialized healthcare. It's something that the Democrats have been asking for years. Maybe it'll work out really well and we can finally get it. Number 2, the bailouts. Well, not technically a bailout, but economic stimulus. They're talking about giving out small business loans to those industries that are most heavily affected by the virus, including tourism, travel, etc., etc. Most importantly, which will affect most Americans, is the tax holiday, which means no paying payroll taxes. I can't wait to get my 25% extra in my paycheck. And lastly, this is a global issue. And we keep talking about it like we're going to work with just the EU or just with China or just with Canada or the UK. This is a situation that we have to work with all countries across the world and stop putting up these boundaries. Because guess what? Iran has scientists, Syria has scientists, and if they're the ones that come up with the cure and you keep pissing them off, they're certainly not going to want to share it with us. Now let's talk about what's trending in social media. If you look at Instagram, hashtag coronavirus is one of the top trending. TikTok, hashtag coronavirus. Twitter, coronavirus pandemic is the top hashtag. And as you can see from here, it is absolutely wild on the internet. Now, let's talk about Tom Hanks. He's got coronavirus. He was down in Sydney. His son keeps coming on with no shirt on, talking about how they're doing just fine. However, now there's a Hollywood face to the virus. So, of course, we'll find a cure real soon. Now, let's talk about what we are doing to help mitigate the situation. I got an email from ASU the other day saying all in-person classes have been canceled. Universities across the country are doing the exact same thing, and it is causing major issues in the academic world, but now public school systems for K through 12 are doing the exact same thing, sending kids home for the next 4 to 6 weeks to just learn from home. I keep getting hundreds of emails now from different companies, Uber, Postmates, Capital One, American Express, Delta, Southwest, American Airlines, all talking about what they're doing to mitigate the health situation for their consumers. I get it, everyone's reacting. I don't need an email about it. Everybody should be doing what they should be doing to protect themselves. Now let's talk about masks, toilet paper, and soap. Today we went shopping at Fry's, and I kid you not, there were 2 people wearing painter's masks on their face the entire time they were shopping. Painter's masks. Not any sort of surgical mask or the N95 mask they're talking about. These people went to Home Depot and got painter's masks. Now I understand the thought process. If you're wearing these masks, then obviously the germs can't get to you. The point is, these germs get into your eyes, they get through your nose, they get on your hands, you wipe your eyes. These masks are for people who are actually sick, to stop you from getting the virus from them. So if you're going out and buying these masks and they're not there for the people who are actually sick, it's just increasing the chances that you're going to get yourself into a situation where you're going to be positive for COVID-19. Toilet paper.
Well, test came back and it is positive for coronavirus, COVID-19. I'm very sorry. It's not possible. I have so much toilet paper. Do you need to see it?
I'm not really sure the correlation between toilet paper and the coronavirus, but my understanding is that as this gets crazier and crazier and more people get infected, people are concerned that they're not going to be able to wipe their ass, I guess. So, go get toilet paper. I'll just use a bidet. That's fine if really times get tough, but I really think that people are panicking. Like, go get 4 or 5 rolls. You're going to be fine, Nancy. And lastly, soap. And this one's for Deborah, sitting at home with a stockpile of antibacterial soap. Your hands might be clean, but now everyone else's aren't. And guess what? That's how the virus spreads.